our units and our leadership. And so I am going to go ahead and get started with Chrissy Coleman. And so she is one of our managers on our unit here. So I am going to get her slide up here and hand it over to Chrissy.
Well, good morning, everyone. Thank you for joining us today. I'm Chrissy Coleman, the nurse manager of 5 North Progressive Oncology. We're a 16-bed unit, and we currently have 2 night shift openings. And as you can see on the slides here, we have a few pictures of some of our team members. Let's see, we celebrate an Employee of the Month award, so you'll see a few of those pictures in there. Also, a picture celebrating when we were a year CLABSI free. So really just supporting one another, recognizing one another. Actually, just yesterday we went bowling, and it's the first time we've all been together for a while. So that was nice to be able to do some things outside of work as well. And then, the great things about our unit, you can really learn a variety of skills, as well as developing great relationships with patients and their families as they're going through some of the most difficult, challenging times of their lives. We do administer chemotherapy and take care of end of life as well. So yeah, we're a great team, and we would love for you to join our team.
Chrissy, can you just share a little bit about how many beds you have on your unit, maybe your nurse to patient ratio, any of that kind of information, and maybe what a day in a nurse's life on your unit might look like?
Yes, of course. So we have 16 beds, and nurse to patient ratio is dependent upon how many progressive patients we have on the unit. And so that could be, you could have a 1-to-3 or 1-to-4 nurse patient ratio. So keep it very low nurse to patient ratios. And a day in the life, very busy. We keep very fast paced, could see many admissions, many dismissals all within a day. But then some of our specific oncology patients could stay up to several weeks or a month, or then, could come back in subsequent months for treatment. And so you really do get to know those patients and their families, and they get to know you as well. So great teamwork. I'm always hearing our team asking, hey, what else can I help you with? So very teamwork focused culture. Everybody helps one another, and very proud of our team. We do great work.
You guys do awesome work. So thank you. And so for all of our participants, I'm going to just cruise through here kind of our units, and then we'll open it up for questions, or you guys can really ask the leaders questions about their unit. So I'm going to advance to our next unit here, which is Janelle Bray's unit, which is over here also on East Campus, our 7th floor.
Good morning, I'm Janelle Bray. I've been a nurse at Bryan for 23 years, and I am the manager of 7 East, which is a medical renal unit. We're a medical progressive. We also specialize in urology surgical patients and dialysis patients. The nurses on my unit are trained to do peritoneal dialysis as well. We have 17 beds, nurse to patient ratio, progressive. If you're assigned to progressive patients, you are a 3-to-1. If you have general care patients, you are a 4-to-1. Some great things about my unit on 7 East is we have amazing retention. We have multiple nurses with over 30 years of experience in dialysis and urology surgicals. We have great teamwork. My staff is great at pushing each other and building each other up and encouraging everybody to do their best.
That's perfect. Thanks, Janelle. Is there anything that maybe your nurses might say, like, this is the best part of my day, or what is kind of the most rewarding part of their shift that maybe you could share with the group?
Sure. So 7 East is unique. It's a great place to learn. We have higher acuity patients, and we also have a nice balance with the urology surgery patients. So some of our more chronically ill patients can stay for multiple days, especially the dialysis patients. The staff get to develop relationships with these patients as well, because we see them frequently sometimes. We have a great mix of, like I said, the general care, plus you get the critical care part as well. We do a few drips. We have BiPAP patients, high flow O2. So you really get a mixture and a great balance of medical versus surgical patients.
That's great. Thanks so much, Janelle.
Yeah.
Our next unit we're going to kind of just briefly touch on here is our observation unit. And Sally Bach is our manager for this unit. She's with us today. She does have units on both campuses, so we'll let her talk a little bit about her unit. Sally?
Good morning, everyone. So the observation unit is new to Bryan Health. So the first unit on West Campus is an 11-bed unit. It opened the end of July. And then there's a unit over here on East Campus. I say over here because I am on East today, is a 9-bed unit. And we just opened this unit on Monday. So the observation unit is unique. Lots of large organizations have observation units. So these are patients that the ultimate goal of these patients is just to monitor them, do some extra testing, and hopefully send them home or place them in appropriate care. So we are a general care and progressive care unit. Our goal is to send patients home in 24 hours or less. Obviously, with observation, that doesn't always happen. Not everybody meets inpatient criteria and stays observation. So we have a great team that we've built. I think when I took on this position in April, we had about 6 employees. Now we're up to about 42. I have currently 4 night full-time positions and 2 part-time day positions available. I just hired 2 people yesterday for full-time nights, so that's awesome. We've really have a diverse team. We have men, women, and really just great experience from outside the organization, different people from all different backgrounds that have come to join our team. So with COVID, we have taken on some more inpatients, progressive care and general care, just to help out the other units. So we weren't getting as many observation patients, but now we're starting to see that population again, now that COVID is really slowing down. And we're hopeful that with our team, we'll be able to start doing some exciting things outside the organization together to really start to get to know each other. Now that things are starting to open up, we can start having a little more fun getting to know each other.
That's perfect, Sally. Okay, have you seen some success stories with your staff and with patients? And I know just being an observation unit, there's maybe kind of like you said, that quick turnaround where we're either hoping that they go home or on to another inpatient unit. But do you have a story that you could share at all?
I would just say my team has been super flexible. When we first started, we were turning patients around quite quickly, which was great. And we kind of got in the habit of doing that. And then with some of the progressive patients that we've had, they didn't have a lot of progressive experience. But I would say over the last couple months, they have really done a great job taking that ownership of that and learning so much. So I think they're pretty much open for anything and very flexible. We're building a really great team.
I think flexible is the key word. Perfect. Thanks so much, Sally.
You're welcome.
All right. So the last unit that we're going to kind of visit here today on our little virtual tour is Nicole Bap's unit. And this is a West Campus unit. It's our 6 South Neuroscience unit. So I'm going to turn it over to Nicole.
Good morning, everyone. Like she said, my name is Nicole Baps. I am the nurse manager for 6 South Neuroprogressive Care. This unit is a 24-bed unit. It is very fast-paced. We have quite a mix of patient populations up there. We were a designated COVID unit with early March starting, and just recently we have been able to transition to only 3 COVID beds. Really throughout the last year, the staff and the relationships and the bonds that they have truly made with patients and with each other have been phenomenal. They have been stretched and pushed, and it has created so much growth in them. It has really been a great opportunity to come alongside of them and see the care that they provide every day. The relationship that my team has with physicians, ancillary staff, it is phenomenal. And it is what creates that culture of really that teamwork that makes everyone successful, patients going home early and the staff feeling that they accomplished something throughout the day. So we do have a high amount of surgical patients, so it is a fairly fast turnaround with that. Because we have progressive patients in there as well, we do staff depending upon what our census kind of looks like. Our progressives, we do try to keep those at a 3-to-1, and our general cares are a 4-to-1. But the staff are really good at working with each other, because with our acuity, with the fluctuation of the surgical patients in there, it is a high turnaround on some patients. But the staff really are phenomenal working together. They've had a lot of fun over the last year, even with COVID. They've really kind of established some new bonds that have really strengthened the team in a way that was unexpected.
That's perfect. So I'm going to open this up really to any of the four of you leaders, but what do you guys feel like you could share with our participants about what you feel like sets Bryan apart from other organizations in the region and in our area?
I can start. I failed to mention that I worked for Bryan for 17 years. So right out of nursing school, I came to work for Bryan, and I bleed Bryan blue, just like most of the gals on this team. But I would say Bryan does so much for their employees. They're very, very thoughtful. Our senior leaders are always wanting to do what is best for our patients and for our nurses. There's not a day that goes by that we know that they don't have our backs. Everybody knows each other. Everybody's super friendly with one another. I wouldn't want to work anywhere else, so I'll let somebody else go.
This is Chrissy, and yes, I definitely agree with Sally. Sally and I graduated nursing school together, and really appreciate the opportunities for continuous learning and growth. You learn something new every day. There's opportunities to do something different every day, whether it be working on committees, leading committees, being involved, and you really have the support of your coworkers and also leadership as well.
Yeah, this is Janelle. One of the things that I've observed over the years as being a manager is anytime that we've had travel nurses or anybody that has worked at other organizations, they always comment on what a great place Bryan is, as far as the staff, the culture of the hospital, how nice everybody is to one another, and all the great interdepartment relationships that we have.
This is Nicole. Just to really mimic what those ladies have said, really, there is longevity in this organization. I started here as well as a new grad. I don't know that I will ever leave Bryan. I've been in multiple roles throughout the organization, even transitioned to the Bryan Physician Network, which is an ambulatory care. And I knew I'd come back to the medical center. There's something about it. And even being here for 13 years, there's many people that you see who come to the organization and maybe take another opportunity for whatever reason outside of the organization, and you see them back again. So it's a great feeling to know that Bryan provides just that culture of belonging, and it's across the board, not just in nursing, but all of our ancillary staff, the relationships that are established with our maintenance providers, our OT, our PT, our nutrition and dining. You get to know everybody, and it's not just a high five when you're trading off from shift to shift.
Perfect. I think you guys hit it on the head exactly. And they're right. There is a little bit of longevity in this call. And so I do think all five of us have been here. And so with that, I really just want to open it up to all of you as participants. This is a great time for you guys to ask us questions. So whether you have questions for any of the managers or myself, we are happy to answer questions about Bryan in general or about their units that they've presented on. And so feel free to either come off of mute or type something in the chat, but we're gonna, I saw Julie came across and said we have about 10 minutes. So I do wanna just open it up for you guys to ask us any questions you might have.
Hi, my name's Emma. I go to UNMC. I'm graduating in May. I had a question about what you guys do for supporting new graduate nurses and what that looks like on your units.
I will just start with just a brief. These girls are probably going to laugh at me, but so I co-coordinate the nurse residency program. And so that is a year-long support for new graduates. And we are going to talk about that at the end of this career fair. My co-lead is going to kind of share that, but I am going to open it up to the managers to kind of talk about how they support not only their new grads, but all of their new staff through the orientation process. So managers, do any of you guys want to answer her question?
Well, this is Chrissy, and some of the things that we do to support our staff would be to encourage and support new staff through rounding and meeting with you at least every 1 to 2 weeks to check in with you to see how you're doing on orientation. And then even once off of orientation, both the preceptors and then myself, as well as the clinical resource nurse, frequently check in with you to ensure that you're doing okay, to address any concerns that you might have and to support you in any way that we can, and really including you in, our 5 North gatherings and celebrating you when you pass the NCLEX and, through our Employee of the Month program that we have on 5 North as well. So everybody, we want you to do well, and we want to see you succeed.
It's probably very similar from all the nursing units, but definitely meeting with the new employee every week on our unit is very important. I just brought on a clinical resource nurse to my team in November, so she's very hands-on with that process as well, making sure you're just off to the right foot, making sure that you and your preceptor are compatible together, because sometimes that isn't the case. And a week or 2 in, you guys might not be seeing eye to eye on certain things, or you're just not learning the things the correct way. So identifying those things early and making sure we set you up for success. That's really, really important. And, adjusting your orientation calendar based on what your needs are, whether that's shortening it or making it longer. Just really whatever the individual needs is very, very important, and making you feel like part of the team.
We do the same kind of things on my unit as well. Just a couple other things that I'd like to add. The CRN, our clinical resource nurse, a couple things that we do is you spend a day in the skills lab just working on skills one-on-one, which the new grads really appreciate, especially if they haven't gotten that opportunity while they've been in school. Another thing that we do is we have the new hire come in the day before they officially start on the unit. And so they spend a day with the clinical resource nurse, touring, finding out where the lab is, where radiology is, where your locker is, how you clock in and out, all those little things to make sure you start off on the right foot for that very first day that you're on the unit.
I can just add that really the clinical resource nurses are so instrumental in the orientation process for all of our staff. It really helps. They come alongside of us and really provide that dedicated education piece to the staff. So we're not missing gaps or creating gaps in the education process. So really they are instrumental. And just to reiterate everything these ladies said, we do try to tailor your orientation to meet your needs. Everybody comes in with a little bit different of a skill set. And so we want to make sure that we're supporting you in the way that you need, and whether that's an extended orientation or just aligning you with a different preceptor. We do take all those things into account when we meet frequently.
Thank you.
Hi, my name is Kate Messinio. I'll graduate from Bryan in May. And my question is, do you what is the process for new nurses to be a part of committees or leadership opportunities Can that happen during the nurse residency within that year? Can we express interest? Kind of how that process would be.
I think most units have unit-based practice councils. We encourage staff to be part of that right away, to give your input into practice changes. As far as leadership roles, obviously you can always show your interest in those things if you want to advance yourself. Typically as a new nurse, definitely that first year is very important to learn all of your, just getting your bearings and getting your feet wet as a nurse. I think that after the first year, definitely leaders, you can express those leadership opportunities. But being part of committees, I think that's any time, and the more you can want to reach out and be part of things and show commitment, that will also help with leadership opportunities in the future for you.
Hi, my name is Rosis, and I've been a nurse for about 6.5 years, doing a little bit of everything. My question's for Sally. For being a brand new unit, what kind of mixture of experience did you hire? Because I know sometimes with a brand new unit, it's kind of hard maybe to get that mixture. So I'm just kind of seeing if you have like mostly new, veteran, kind of the mix that you have.
So I have probably a handful of internal transfers that came to me from either general care or progressive care here within Bryan. And then I would say I have several long-term nurses. I have a nurse that came from Norfolk that worked in the ICU for lots of years, quite a bit of rehab nursing, critical access hospital nursing. I do have a handful of new grads on my team. I do have a fair amount of nurses that have quite a bit of experience though, which is good.
Another question is for all the managers. When you are looking to hire, what is the qualities that you're looking for in a nurse when you're looking to hire?
This is Chrissy. So someone who is willing to learn and grow and to take every opportunity for that. Somebody who is a team player, who's professional and expresses the Bryan core values in every interaction.
This is Nicole. I would just say one of the big things is really the personality to be a team player, the collaboration, and it goes beyond nursing. And so really how we work with our ancillary departments is just as important, how we work with our other nurses on the floor. So that's a lot of what we look for, is just making sure that we do have the right fit. We all have different patient populations, so we want to make sure that we're feeding your passion and that you're making the right choice. So it is an opportunity for you to have longevity in your career as well.
All right, guys, it looks like we're about to get closed out of our breakout room. So thank you so much for spending some time with us.